the classic psychedelics, it's a different experience. And people tend to have very altering and slightly more, or often profoundly more, disorienting type experiences under effects at psychedelic doses or higher doses. So in that context, in therapy with classic psychedelics in general, individuals are really encouraged to stay in an inner focus, to kind of use eye shades or often headphones or ambient music, but to keep directing attention inside and to kind of journey in that space. Now, in MDMA-assisted therapy, this orientation is also recommended and supported to go inside, to connect with inner healing intelligence. Eye shades are also offered, as are headphones, and a person is encouraged to explore inwardly and to trust that journey and to go into that whole inner universe that can really shift and change with the music and with what is being unfolding in the psychedelic session. But it's different insofar as MDMA is, again, less ego-dissolving and more relational. So in MDMA-assisted therapy, we might see more of like a pendulation between going inside into one's inner experience, into their mind's eye, into their emotions, body sensations, anything arising in the inner realm. And then when it feels like they want to, or if a therapist checks in after a period of time, maybe an hour or a more prolonged period of time spent inside, then the participant might come out and take off the eye shades and actually interact and relate with the therapist. Now, time outside versus inside is generally more in MDMA-assisted therapy with that relational aspect, that empathy and trust. It's been seen in sessions that participants will tell stories, will talk and want to talk and share a lot in some sessions with the co-therapy team, speaking about events of the past, speaking about ways that they're thinking about things. And that kind of verbal and emotional connection can absolutely be part of their therapeutic process. Oftentimes, shame is reduced. This may be the first time that a person's actually connecting with a really true and deep story and sharing that with people who are attuned and listening empathetically to that story. Now, with the classic psychedelics, going from inside to outside could be a lot more disorienting potentially because of the alteration in vision. So visual hallucinations, or the sense that things on the wall are moving, different sensitivities to light, and even sometimes with the more ego-dissolving effects of classic psychedelics, carrying a conversation with a therapist might itself be really difficult or not part of the process, less so than with a really relational medicine like MDMA. So for that reason, the therapist may be less engaged in this active, relational, verbal, and even nonverbal expressions with a participant with psilocybin or LSD than they would be with MDMA.
This mini lecture is part of Nuances' Introduction to Psychedelics, which is a free course where we explore the world of psychedelic medicines and their potential as therapeutic tools. Check out the link in the description for more info.